Excuse me? You want a tat? No, you... Oh, cat. Okay, a cat. You want to go to the do? What do you... Oh, the zoo. Okay. You need the tea? You don't drink... Oh, you want a key. You want to eat a pea? Oh, the peach. Okay. There's a bud on me? Oh, a bug. Your feet hurt? What? Oh, your feet. So, do any of these things sound familiar to you? If so, there's a chance that your child might have some speech problems with certain phonological processes. Often when we have kids who have difficulty with certain speech sounds, they don't necessarily have problems with producing a sound or two in the right way. They have issues with producing particular groups of sounds. So usually when we think of a kid having difficulty with speech, we think of them having a hard time with maybe producing R like in wabbit or S like in thither. When a child has difficulty with shaping their tongue properly and putting it in the right place like this, this is referred to as traditional articulation errors. But when a child has difficulty with phonological processes, they are generally able to make the sound properly when given a model, but they don't produce it correctly in conversation. And this has less to do with using the tongue properly to produce the sounds and more to do with not actually hearing a distinction between the sound that they are making and the sound they should be making. So when a child says bud instead of bug, their ears need to be trained to hear the rather slight difference between duh and guh. Or one very common phonological process is when kids have difficulty with all the sounds that have airflow. So s, z, sh. Kids will often stop the airflow, and this is how zoo is turned into do. Now, many phonological processes are developmentally appropriate, so if your child is doing some of these things, there isn't necessarily a reason to sound the alarm. Having said that, there are certain phonological processes that should diminish by certain ages, and some phonological processes are never developmentally appropriate. So if a child drops off like an initial consonant, so dog turns into og, then that would not be considered developmental. So, what to do if you think your child might be having these types of errors with speech? As I mentioned, phonological processes are much more listening based than they are teaching proper placement of the tongue. So if you notice that your child is saying do for zoo or tat for cat, repeat it back to them in the proper way and see if they think that is correct. Then you can ask them to raise their hand when they hear it being said the proper way. So raise your hand when I say zoo, and then repeat zoo. And you can try that with do too, and hopefully they don't raise their hand. Also, take extra care to overemphasize the sound or sounds that they are producing improperly. We call this auditory bombardment. So while they're reading books or during playtime, overemphasize the sounds with airflow. Or if your child is dropping off final consonants, like in P for peach, overemphasize the final consonants in all basic words. There's also a lot of content out there that provide minimal pairs. These are generally flashcards that pair cards with what your child is likely saying with what they should be saying, and they can be pretty helpful.
So honesty, I'm going to be saying two words. One has your short d sound, d, and one has your long z, your buzzy b sound. So I'm going to say one, and you try to guess which one. Are you ready? Do. Good job. Okay, what about this one? Zoo. Good. That was way longer, huh? I went zoo. Okay, try another one. Zoo. Which one did I say? Good job. Good listening.
But ultimately, if you are concerned that your child is not growing out of some of these types of articulation errors, it would be best to just consult a local speech therapist to see if your child is indeed having difficulty with phonological processes and then ultimately they can tell you what to do to help.